What if I told you that there is a common treatment that can help with the symptoms of irritable bowel syndrome, which is a GI problem, migraines, which is headaches, POTS, postural orthostatic tachycardia syndrome, which is a cardiovascular problem, and the last one but not least, autism, ADHD, and fibromyalgia or chronic pain. So these 5 things look very different, but they all can be treated by a reattunement of your nervous system. Hello, I'm Dr. Sarah Alfecki. I'm a primary care doctor, specialized in internal medicine, practicing here in San Diego. And today I'm going to talk about the autonomic nervous system, or the self-defense mechanism of the body, and how that, when it's dysregulated, when it's always on in the face of safety, when you're in safe conditions and you're responding to a perceived threat constantly, even though everything is safe around you, but your body perceives a threat, that can lead to the body's reaction and diagnoses that usually have a very normal workup, like migraines. On a CT scan, MRI, everything is normal. Irritable bowel syndrome, on a colonoscopy, upper endoscopy, CT scan of the abdomen, pelvis, everything is normal. Stool studies, normal. In autism and ADHD, if you do brain scans, if you do MRIs, everything is normal. You can't really distinguish the difference between the two. And in people with chronic pain syndrome or fibromyalgia, they don't have any they don't have anything wrong in imaging studies, whether it's the back pain, shoulder pain, the rheumatoid factor is normal, their inflammatory markers are normal. And I'm telling you that there is a common thread. It's because your nervous system is being overactivated, and your body's perceiving a threat, even though it is safe. When there's a disconnect between the way your body is reacting and what is actually in reality, if there's a threat or not, that is a sign of trauma. And trauma doesn't have to be a capital T trauma like rape, or a murder or something like that. It could be a very low-level trauma where your body had to escape reality, and for some reason you fainted even though everything is normal. You're not sick, you don't have an infection, but your body had to protect you from such a bad experience in your life that you started fainting. And what I'm trying to tell you is, if we can teach our kids and teach ourselves how to be very attuned to our autonomic nervous system, when we can take deep breaths to slow down our heart rate, because our heart and lungs are working together. When we connect, we activate the healthy nervous system that is for bonding instead of for danger.